do this kind of thing quite often, so sometimes I catch myself thinking about other things while I'm saying words I've said more than once. So anyway, I'm going to assume that at least some of you don't know very much about what we do, and so we're just going to talk about the basics, and we're going to go all the way through. Typically, what we do takes maybe around 90 minutes, and that includes all the questions. Okay, I put together a bit of a PowerPoint. It's not very fancy. Its main purpose is to keep me on track, and it also gives you the opportunity to see my bullet points and see. You may have a question that you're thinking about, and then you'll see, oh, he's going to cover that one, and that works fine. But you're still welcome to ask questions anytime you want to. Okay. Our members use us with very little exception instead of health insurance. Okay, so the presentation is primarily designed to give you the opportunity to see how we work instead of insurance. And when you shop for health insurance, which some of you in this room probably even better at that than I am, when you shop for health insurance, it's really just about numbers, right? I mean, very few people get an increase from Blue Cross or Pacific Source or whatever, and they get on the phone. You don't call up somebody like Blue Cross and say, tell me what your statement of faith is, tell me about your worldview and that kind of thing. People don't do that. You just say, shoot me numbers. That's really what it's about, right? And we understand what those numbers represent. They come in insurance terminology. You know, there are things like premiums and copays and deductibles and out-of-pocket limits and networks and those kind of things. Well, we're not an insurance company. Our members actually love what we do better than insurance, believe it or not, and hopefully as the evening unfolds, you'll be able to understand why we do that. I am going to have answers to all of your numbers questions, but my passion goes way beyond that. My passion is to at least give you a glimpse of the things that our members actually love more than just the numbers, okay? I think you'll find our numbers pretty favorable. Our members typically are saving an awful lot of money, but there's things about the way we operate that our members actually love more than that. So that's going to be my goal, is to try to at least help. As I answer those questions about numbers, I'm hoping that I'll be able to answer your questions about what is it that we love about it and the fact that it's different than insurance, okay? So the way I've decided to do that is I'm going to ask you a few questions here to try to get you just beginning to think about how different we are than insurance, okay? So here's a couple questions. You don't have to dwell on them we're not going to spend a lot of time on them. But have you ever wondered where your money goes when you give it to an insurance company? You ever wondered what they do with it? Or what they use it for, or where it ends up? You ever wondered that? I think it's a healthy thing to wonder, and our members actually appreciate that because they get to know where their money goes when they're working with Samaritan. Some of you are probably well aware, I do some of these meetings all over the country, so if I'm in Pennsylvania, I'll say what I'm about to say and they won't understand it, but you guys will. The fanciest basketball arena in Oregon is where the Trailblazers play. And you know what it says on the outside of that? It says MODA. MODA is a health insurance company. So there's one answer to that question. That's where somebody's money's going. Put a name on the side of a building. A lot of people will say to me, well, I have really good insurance, so I probably don't have a need for this. And I have to be kind of careful and bite my tongue a little bit, because once you've been around Samaritan for a while, we begin to wonder if there actually is such a thing as really good insurance. But I totally understand. Some people have jobs where they feel like that's the case. We feel like there's a lot of limited provisions with insurance, and there's a lot of financial risks. There are, if you try to do a comparison between us and insurance, and you use something for which most of us want insurance, if you take out government intervention, nobody pays $15,000 to $20,000 a year just so they can get an occasional help with a doctor bill. That doesn't make a lot of sense. What do we have it for? Well, we know that families could actually face some very significant financial burdens. So if you do a comparison, let's say somebody in your family gets a rare form of cancer and they fight it for 5 years, and you roll over some deductibles for 3 or 4 years, those can really add up, and a lot of the limitations and things that some companies decide they're not going to cover and stuff. A lot of families can find themselves still out of pocket $20,000, $30,000, $40,000, and our members appreciate the way our system works, because that really hasn't happened for Samaritan Ministries. I don't know how you guys view some of the New Testament doctrine, and I hope I don't step on any toes, but I believe that the New Testament teaches a principle called stewardship, where it implies that what I have, my resources are not actually mine. They actually belong to the Lord, and He's entrusted them into my care, and I'm to manage them with knowledge of Him and His priorities and stuff. And so what that means, in a sense, is that, to me anyway, it means that a lot of the financial decisions that I make have a spiritual element to them, okay? And so I love having a meeting like this where I can give a Christian family the opportunity to consider the possibility of saving a lot of money. And I like to say, if I end up saving you $10,000 a year, do you think you'll need my help figuring out what to do with that savings, or do you think you can handle that on your own? Most people figure they don't need my help on that. Have you ever asked yourself this question? Does our family's approach to healthcare bring glory to God? That's a question most people haven't even considered, and that's something our members actually really love, to just be able to think about that possibility. A growing number of doctors are pretty frustrated with what's going on with healthcare in America. I don't know if you're aware of that. There's actually a growing movement in America that we refer to as DPC, or direct primary care, where a doctor has just come to the point where they say, I'm not doing this anymore. I'm not going to deal with an insurance company. It is not good for my patients. I'm going to approach this totally different. And what they do is they will say, you can come when you want to, and I'll charge you a fair cash price, and if you want to deal with your insurance company, that's up to you. Or they also have a different model where they say, I'm going to take a limited number of people, pay me a subscription, so much money every month, and we'll take care of any problem you have. You'll have 24/7 access to my cell phone. I'll come to your home if I need to. You can visit me all you want. And when we get there, we're going to spend enough time so that we hope we'll find really what's going on with you, really get to the root causes, rather than that 15-minute segment where we might be fortunate enough to figure out what your symptom is and be able to prescribe a drug for that symptom. That's what a lot of doctors are really frustrated about. And so we're aware of at least 8 doctors in America that are members of Samaritan Ministries that have done that. And one of them lives in Albany, not too far from here actually, not too far from where we live. Last summer he put on a seminar for the entire town explaining to them what he was going to do. And so I went to it, and it was extremely informative to me. This bottom bullet point came from him. He basically said, you need to understand that if you go to a doctor and you have insurance, you are not actually the customer. There's a third-party payer in that room. You may not see them, but they're extremely influential in how that entire transaction takes place. Them, government intervention, in the pharmaceutical industry play a huge role in how doctors are allowed to treat people. And he said, and he went on to explain a variety of things of why that was so frustrating to him, that he felt it was so unhealthy for his patients, he just couldn't do that anymore. So it's very informative to me. We'll talk about that a little bit more. So let's get into some basic facts, okay? And remember, you can ask questions anytime you want to, okay? Here's some background facts, and then we'll start explaining how our program works. We are not a brand new organization. We started sharing in 1994. So some people kind of wonder or assume that we might have just sprang up as a reaction to Obamacare. That's not the case. Because of Obamacare, we've certainly grown by leaps and bounds in the last 4 years. But we started sharing in 1994. My wife and I saw an ad in World Magazine in 1996, and we kind of reacted like most people. This sounds too good to be true. But we started looking into it, started praying about it. We got a list of references of people, of the very few people who were involved at that time. We called a few of them. We decided the Lord was involved, and so we joined in 1996. And so when we joined in 1996, there were about 300 families. Come on up front, close, and where you can hear me and where we can hear your questions.
We got 8 people on here.
Listen live. Some of them decided to get in their car. Great. Okay, so when we joined in 1996, there were about 300 families involved. Okay, so it's a pretty small organization. So if I was doing this meeting back then, it's very probable that somebody in this room would probably say something like, so what are you guys going to do if 2 families have a $100,000 bill in 1 month? And my answer would have been, I'm not really sure. I've been trying to teach myself for about 40 years of my adult life that if it's above my pay grade, I'm going to try to let the Lord worry about it. And that's the only answer I would have had, okay? So here we are. As of a couple weeks ago, we're pushing up to 62,000 households now. We're at 61,800 this week, which involves about 203,000 people. Our members are sharing a little more than $18 million each month in each other's medical bills. And to our knowledge, in 22 years, there's not been an eligible need that hasn't been completely shared and met. Okay, so remember what I said my answer would have been. That and say, who knew that worked, right? He has honored what we've done, and he's been the one that we put our most trust in, and that has worked very well for us up to this point. Believe it or not, by God's literal, in our opinion, miraculous grace, we have our own exemption clause written in the Affordable Care Act that says our members are exempt from the penalty for not having insurance, and we thank God for that. And that's obviously one of the main reasons why we've grown by almost 40,000 households just in the last 5 years, okay, because of that. So that's kind of the background. My personal background, I'll give you just a hair more. We've been members for coming up on 20 years. I actually served on the board of directors for Samaritan for 14 years until I went to work full-time for them about 3.5 years ago. And so then, because I'm being compensated, that was a conflict of interest, so I had to step off the board. So I haven't been on the board now for 3.5 years. Some of our board members are appointed and elected from the members at large. That'd be available for any of you if you're willing to do that. So that's how I became a board member. Okay, now we're going to start going into details, just talking about who we are, what we do, how it really works, okay? And again, as I said, ask questions anytime you want to. We are trying to be a network of Christians, a network of serious followers of Jesus Christ. Okay, that's what we're trying to do. So you can probably imagine if we had 10 different pastors write down what does that look like, we'd probably get 11 different answers. Okay, so here's what we've done. This is what we believe our members feel comfortable with. We have 5 questions that we ask you on the application to say yes to. Okay, anyone who's going to be in the membership that's over the age of 18. Okay, that's what we ask. All right. So, question number 1, we ask you to tell us that you have read our guidelines, which I have in those information packets. You've read through those. You've read our statement of faith, and you're comfortable with the statement of faith. Okay. Number 2, we ask you to tell us you don't use any tobacco products. Number 3, we ask you to tell us you don't use illegal drugs nor alcohol in excess. Number 4, we ask you to tell us that you don't participate in sexual activity outside of the biblical definition of marriage. And number 5, we ask you to tell us that you are a part of a community of believers and you attend services at least 3 times a month. Okay? Those are the 5 criteria questions. If you're able to answer those in good faith, then it's not a matter of wondering if we're going to accept you. There wouldn't be any reason that we would reject you if you're able to answer those. There is a portion on the application where we ask you to take it to someone with whom you have a spiritual accountability relationship, like a pastor, an elder, a home group leader, a Sunday school teacher, someone who knows you well enough that they're willing to sign their name and say, hey, I know this family and I believe what they've said about themselves is true. Okay, so that's a small step we've taken to try to protect the ministry from fraud and abuse. I think it works pretty well. It's probably not perfect, but I think it's doing a pretty good job. Okay? All right. Some people assume when they just begin to try to get their mind wrapped around what this sharing organization is all about, they assume that what we do is that we publish people's health problems out in the newsletters, hope somebody sends them some money, okay? And that's not how it works, okay? We're highly structured. It works very well, and it's very structured, and it's very efficient to a point, just like the church is very efficient, right? Church is kind of messy, but that's the way God designed it, right? Our members have fixed monthly share amounts that they can plan on and budget for every month, okay? And so you'll see what some of them are up there. A single membership is $180 a month. A 2-person family is $360 a month. A family of 3 or more, no matter how big, okay, no matter how big, is $405 a month, all right? And we have a 4th category for a true single parent with children, which is $250. So those are 4 categories. And then we also have 4 corresponding share amounts for what we call a young adult discount. So if either head of household are younger than age 26, then there's a discounted amount until both heads of household are over 25. Okay? And I can tell you what those are. It's 140 and 280, and families 355, and the single parent is 200. Okay? Now, one of the questions I need to kind of add right in there is, does that ever change? Right? And the answer is yes, it does. When my wife and I joined back in 1996, the share amount for a family was $150 and it's $405 today. So that's what it's done in 20 years. We don't change it automatically every year. We simply change it when we have to, when we're forced to. We hope it stays as long as we can, but when the share amounts are no longer adequate for the needs that are coming in for 3 months in a row, then that triggers an automatic discussion at our board level. Is it now time to have a share increase? They typically will decide yes. They prayerfully think through it, discuss it. They will choose what they think the best wisdom is for the next share amount, and then it goes out to all of our members in a ballot, and all of our members get a vote on it, and if it's passed by 60% majority, then we have a new share increase. That typically happens about every 24 to 28 months, and we are coming up on one of those, okay? I expect that we'll have a share increase probably in the next 4 to 6 months, all right? That doesn't bother those of us that have been around for a while. Hopefully it won't bother you, because by definition, in my opinion, what we are is we're a network of Christians who have gathered together and said we're going to share each other's medical bills. And now we're seeing the bills bumping up a little bit, and so we'll have a share increase, and it's usually voted for, okay? I would hope that happens again this time. The increases are typically about 3 to 5% a year. We have observed at Samaritan for 22 years a very consistent 3 to 5% increase in the actual cost of the medical bills of our members, which obviously is quite a different thing than the cost of health insurance. Okay, that's a whole different animal. Okay, people are not seeing 3 to 5% over 20 years of that. That's for government intervention and a lot of other reasons. People are seeing significantly higher increases than that. So I would expect the family share amount, it'll probably the next time, it'll probably go to 445 or 450 or something, about 5% a year. It's been 2 years, and so that would be about a 10%. That's what I would expect to happen. So I don't want that to be a shock to anybody if you decide to join and then you see that happens. Okay, we are not the only healthcare sharing ministry in America. You're welcome to check out the others. We know of 2 others that we consider viable. One's called MediShare, and one's called Christian Healthcare Ministries. We think ours is better, but I encourage you to check them out if you want to, okay? There's quite a bit of difference between us and the other 2, and this next bullet point is probably the number one difference, okay? We use what we call a direct share model. We're the only organization, to my knowledge, in the world that does it this way. All right. So what this means is that it means that our members get the privilege of sending their monthly share amount directly to a family that has a need every month, rather than sending it to us and having us put it in a huge bank account. Okay. So the way that works is my wife and I get a newsletter in the mail the first of every month, and there's a separate page in that envelope. It's not printed in the newsletter. It goes to everyone. A separate page to us. It says, Jamie and Eileen, this month, we would like you to send your share amount of $360 to, and then it says something like Mr. and Mrs. John Doe in New Mexico, John fell in the backyard and broke his arm. So we do 3 things along with the other 61,000 households. We write the check for our share amount directly to that family. We include a card of encouragement from our home to that home, and we make a commitment to pray for that family all during this month. Okay? That's what we call a direct share model. And I would guess that you can imagine that if you're dealing with something difficult in your family and you're receiving cards of encouragement from Christian families all over the country, knowledge that those families are praying for you or your child or whatever, while they're paying for your entire medical bill, it's a pretty amazing experience. Okay, we kind of have a saying around the offices that once you've experienced that once, you're probably a member for life, because it kind of brings home how different we are than an insurance company. Okay, so that's our direct share model. We begin sharing when our members have a medical incident that goes over $300. Okay, so any need, any medical incident that's less than $300, that means our members take care of that themselves. And when our members have something that goes over $300, then we share 100% of that need that goes over $300. All right, and so an incident, just to make sure we're clear, an incident is not a doctor's visit. An incident is a problem you have with your body until you don't have a problem with it anymore. Okay, so it could involve multiple doctor visits. It could involve specialists. It could involve lab work and MRIs and hospitalizations and surgeries and all related testing and all related medicine. All that is one incident. Our members are responsible for the first $300 of that entire incident, and then our membership share 100% of everything that goes over that. Okay? So that's one incident. All right, so we start sharing at 300, and we share 100% of that incident up to a limit of $250,000 per incident in our basic plan. All right? There's no limit on the number of incidents you can have per person, per family, per year. There's no limit, but there is a limit per incident in our basic plan of $250,000. All right? About half our members seem to be comfortable with that, and the other half, it's about 33,000 households, have joined an additional optional subgroup that we have that's called Save to Share, and the people that are in that group share any need that goes over $250,000 on up to basically whatever. Okay? It works amazingly well. It's amazingly affordable. All right? So here's how it works. Any household who wants to be in that additional group, we simply ask them to make us a commitment that they have an additional amount of money set aside and earmarked in their own funds, ready to be shared if and when it's needed. Okay? And here's what those set-asides are. They're very affordable, in my opinion. A single membership, that's $133 a year. For a two-person family, it's $266 per year. And for a family of 3 or more, it's $399 per year. Okay? And here's how that gets shared. My wife and I are in that group. So in those months when there's actually a Save to Share need, which is a need that went over $250,000 within that group, then, which is probably 6 to 10 times a year now, in 32,000 households, then our letter that tells us where to send our share amount says, Jamie and Eileen, normally you send $360, but this month, because there's a Save to Share need, we'd like you to make your check out for $371. Some additional amount over the $360, whatever it takes to meet that need. It's almost never more than $25, and it's usually less than $10, the additional amount. We're still writing one check to one family, with one family to encourage and pray for, and Samaritan just commits to us that that additional amount that they ask us to add to our check won't add up to more than $266 in a calendar year. Does that make sense? You with me on that? Okay. To my knowledge, no family, I don't believe at this point, a family's never been asked to share more than half of that amount, even though we could share up to $266, but I don't think we've ever had to add more than $125 in 1 year. It's just working that well, okay? Now, whatever we don't share rolls over, and we add another $266 next year, and then we add another $266 the year after that. But the way the program is designed, we never ask our members to accumulate more than 3 years worth of that set-aside amount, okay? And so it's working very well. We don't get our hands on that money at Samaritan. Our members are holding it in their own funds, sharing it as needed in small amounts. Make sense? But we track that fund with our computer. It's called our Save to Share Fund. And right now, just as an example, as of this week, there's $17.3 million in that fund, ready to be shared at a moment's notice. Every Save to Share need that we've ever had has been totally saved and met, totally shared and met, okay? So it's working extremely well. There is a limit for a Save to Share need. No one has ever come close to it, but there is a limit. The limit is 50% of what's in that fund when you have a need, okay? So here's what that means. Let's suppose on my way back to Crestwell tonight, I get in a car wreck and I have huge medical bills, okay? Then the limit for my medical bills would be $250,000 out of the basic plan plus 50% of $17.3 million, okay? So that means that my limit would be pretty close to $8 million. For those of us that have been watching this work for 20 years, including that very bottom bullet point there about the fact that we get very fair prices for paying cash, it's hard for us to imagine a medical need that $1 million or $1.5 million in cash would not satisfy. Okay, that's why no one's ever come close to meeting the limit, and it's working extremely well. Okay, with me on that? That's the Save to Share.
I have a quick question.
Good.
I just want to make sure that I understand it. So we're a 3-person household. If we did the Save to Share, after 3 years, we would need to have $1,200 set aside.
No more than that.
No more than that.
See,
Yeah.
let's say you shared half of it, so that means that's about 200. So then you rolled over 200. You added another 400.
Yeah. Okay.
And then you shared half of that one, and so. But When you're a member, you're given a PIN number for your own personal access, your own member portal to our member website, and you can do quite a number of things in there. And one of the things you can do is find out what our computers think should be in your set aside amount. Okay. So we've been in it forever, and ours is not $399, it's $266. But I looked at it a couple months ago, and it was about $715. Okay, so because it'll eventually get there, unless a whole bunch of sharing happens that hasn't happened. Okay,
Okay.
So you're right, but it would never be more than that. Okay. Any other questions?
Is there any sort of qualification for like an HSA or anything with those? I know it's not a lot of money, but I mean, still, it's tax exempt, right?
I think at HSAs don't they have to be like 3,000, 3,500?
Okay, so you're asking me if our members can use an HSA?
Yeah.
Okay, let's just jump to that bullet point right now.
Okay.
Let's call it tax questions. We'll deal with it right now.
Sure.
Okay. There's about 3 questions that people typically ask about tax. Okay, and so number 1, they ask. Self-employed people especially are able to get some benefit from deducting the premiums they pay to an insurance company.
Mm-hmm.
So they ask that question, can I deduct the share amount that I'm sending to a family every month? Okay, and the answer to that is that our legal department cannot tell you that that's tax deductible. Okay, we don't think it is. There are some CPAs that have chosen to do that. They believe that they were willing to have that argument if they're audited. We don't think it's deductible. The IRS has never ruled on it, but we don't think it is. Okay, that's number 1. Number 2, tax question is that the way this is working, we haven't quite got there yet, but when the sharing happens, that money comes to you. You see that we send it directly to a family. So people ask the question this way, they say, so if I have a $100,000 medical bill, and Samaritan members send me $100,000 and I put that in my own account, do I have to pay taxes on that? And the answer is no. For 22 years, our legal department's absolutely convinced that fits under the gift exclusion that the IRS says if you don't receive more than a certain amount from an individual in 1 year, you don't have to report it, and we'll guarantee that will never happen. So that is not taxable, okay? The other question involves HSAs. The Affordable Care Act has made it very clear that pre-tax dollars can only be put into an HS fund in conjunction with a high deductible health insurance policy, which we are not. That may have been where you were going with your answer on that, okay? So our members believe that it's very clear that if all you're doing is Samaritan, you cannot contribute pre-tax dollars into an HSA fund. If you have an HSA fund now and there's money in it, it's yours. You can keep it. You can roll it over like an IRA. You can still continue to use it for those things that qualify. It's not a problem. But if you switch to Samaritan, we don't think you can continue to contribute pre-tax dollars into it. Now, we disagree with that philosophically. We think all Americans should be able to use an HSA. We've written that exemption. It's been sponsored by a large number of Congress people, and we would love to see it tacked onto a bill and voted on someday, but we don't know if or when that's ever going to happen. Okay? Okay. We talked about direct share model and the sharing and the save to share separate program. Okay, so let's talk about what we share for and what we don't share for. Okay, what we don't share for is fairly cut and dried. We don't share for normal dental things. We don't share for normal vision things. We don't share for what we call preventative care. So if it's not symptom related, then that's something our members can decide if that's what they want to do. They can plan on and budget for that out of the savings and usually do that kind of thing, okay? Things like well visits, annual physicals, routine mammogram, a colonoscopy just because you turn a certain age. If there's no symptom involved, then that's something that we don't share for. We do have resources that are able to help our members as cash paying customers find ways to negotiate and providers that have already indicated a very good willingness to give very good prices for those kinds of things for people that are willing to pay cash. Okay, let me go ahead.
Question: what if there's like a family history of something specific, like a certain type of cancer?
Doesn't matter.
Doesn't matter.
Now, if you go ahead and do something like that and they find something, then of course that's no longer preventative. That's a medical incident. We're going to share that with them, including that first visit. Okay, but yes, even a family history is still not a symptom. Okay. Now, let me give you an example of some of the resources that we have for cash paying patients. Okay. We have a relationship with an organization called medibid.com. It's kind of like the eBay of medical procedures, okay? It's kind of an interesting organization. And the guy that runs it is somebody I've gotten to know pretty well. What you do is you go on there and you enter your profile information and you say, this is what I'm looking for. Primarily people use it for surgeries. I'm looking for my knee to be replaced or a hip replacement or whatever, okay? But you can go on there and say, I'm looking for a colonoscopy. I'm looking for a lab to do my blood work, okay? And so he tells me that as an example for you, he can, and Samaritan members get to use it for free, okay? He tells me that he can find a cash-paying colonoscopy for almost all Samaritan members, typically within an hour's drive of where our members live, with very few exceptions, for less than $700. Now, if some of you are aware of colonoscopies, most people think that's at least a $1,500 to a $2,500 deal. And that's an example. When you are willing to pay people and relieve them of the hassle of dealing with an insurance company, they're willing to give some pretty amazing discounts, okay? All right, final thing that we don't share for is that we don't share for long-term prescription medicines. Now, we understand this is a factor for some people, all right? We share for all prescriptions in the short term, incident related. So if you needed antibiotics, you had a surgery, you needed painkillers and that kind of thing, that's all part of an incident. We share all of that, but we have a limit of 4 months, okay? And so if the doctor says something like, I think you should be on this thyroid medicine the rest of your life, or this high blood pressure medicine or whatever, that's something that we don't share for out past 4 months. All right, so obviously that could be a factor for some people to consider and think about. We have a relationship with several discount organizations that our members are claiming to saving as much as 60 and even 70% on a lot of their medications. And so that's helping in that area, okay? Any questions about that? Okay, all right. What we do share for is things you would pretty much expect, okay? We share for illnesses and injuries and accidents and disease battles and hospitalizations and surgeries and all related testing and all related medicines. Anything that goes over 300, those are the things we share for. We, just to make sure that you would probably assume this, we don't share for things that are going to violate our collective biblical conscience. Okay, so we're not going to share for an abortion. We're not going to share for a sex change operation. There are some things that most people would not have too much trouble figuring out that would violate our collective biblical conscience, and those things we're not sure for. In our information packet, you'll see a purple book that says guidelines, all right? We really want you to read through that if you're thinking about becoming a part of us. We don't want you to just join hoping it works but not understanding it. We really want you to understand it completely, and that guidelines manual goes into a lot of detail. And it will explain some things about listening, it explains some things about alternative medicine, it explains a lot of things that we may not fully cover tonight, okay? I want you to do that.
I have a quick question.
Yep.
So for like a pregnancy, would that be considered an incident? Or so it would cover, you'd just pay $300 and that would cover all of the
We call that a
prenatal
maternity need, and we don't think there's any better definition of being pro-life than sharing all parts of bringing God's blessing into the world. So we're going to share all part of that. You will be responsible for the first 300 unless we get discounts, which I'm about to explain. Or if you happen to be one of those brave women that wants to have a home birth, if that were the case, we waive that 300 and share the whole thing. Okay? But if the whole thing is all part of something we share, all of the prenatal and everything is all part of that, and it's all one incident. You're correct. Okay? And that hopefully that expands farther into those other questions. You know, a 4-year cancer battle is all one incident. Okay? That makes sense? If the symptoms are, if you're dealing with something that's connected, it's all one incident, okay? And so we'll share it multiple times, all right? And that's one of the things that sometimes get asked. You know, a maternity need is a good example. We don't expect your midwife or your doctors or hospital to wait 11 months before they get paid. So one of the discussions that we'll have with you when you first call us and talk about it is how often should we share this need? We value your reputation, your credit rating, and so we're going to let you and your doctor be a part of that discussion. Maybe we're going to share it 3 or 4 times. Maybe at 3 months months and at 6 months or 9 or whatever. Okay, the farther out you go, the more simple it is, but we also don't want people to be nervous about whether you're gonna pay or not. And so it's still part of all one incident, but even if we share it multiple times, okay? All right, this next point is something that's really important for us and our members. We believe that Christian families should be empowered to make all the decisions about their own health care, okay? We don't think you should be limited to a network of low bidders, which is what a network really is, and we don't think you should be told what kind of health care you're gonna get and where you have to go to get it. We think you should be able to make all of those decisions, and that includes a considerable amount of alternative medicine. If you'd rather see your naturopath, if you'd rather see your chiropractor, we think those are decisions you'd rather be able to make. If you'd rather have a home birth, you'd rather use a midwife, a doula, those are decisions we think you should be able to make, and there's no penalty for that, okay? So that's really important to our members and to us as Samaritan. It's more important than price, all right? So I don't know what that means to you. Some people have not had a real problem with the networks they've been involved with, and I understand that. That's great. I'm glad to hear that. But it can be pretty important. Let me give you an example. I was doing a presentation exactly like this last spring in New Jersey, and a pastor in the back row, right when I got to this point, he raised his hand and he said, "Could I just tell you my story real quick?" And so he said, 3 years ago, my wife got a rare form of cancer, and we were with Blue Cross. And so we went to the hospital in our network that we had to go to. We had a consultation meeting. It lasted an hour and a half, and nothing about that meeting felt good to us. The whole thing felt wrong to us. It felt terrible. Now, I know that's not everybody's experience, but this was his story. He said they didn't seem very personable. They didn't seem very confident. They were just saying things like, "We're going to fill your wife's body full of poison and hope the right things die." And it felt terrible to us. So we went home and we started doing research, and we did a lot of research. And we discovered a clinic out in San Diego that made sense to us. It just felt right. So we flew to San Diego. My wife went through their treatment program. It worked fantastic. She's been cancer-free for 2.5 years, but Blue Cross would not pay 1 penny of those bills. And we had to spend 2/3 of our retirement fund to get my wife well. So there's an example of a family that would have had a very deep appreciation for our principles, that we think those are decisions that all families should get made. That make sense? Okay, here's the next one's a question that a lot of people ask right up front, so it's definitely one of my bullet points. The question is, so how does this really work? What is the experience like when you go see a doctor? How, normally I'm used to putting this card on the table, I don't even think about it anymore. How does this really work, okay? So let's answer that question to the very best of our ability. When we go see a doctor, a clinic, a hospital, what's the first question they ask? They put a clipboard in your hand and you go sit down. What's the first question? Do you have insurance? Okay, and our answer is no, I don't have insurance. Okay, I am a cash paying patient. Now, most of our members, when they're dealing with something affordable, something they're able to take care of, maybe they've saved some of the money they've been saving, or they got room on a credit card, okay? It's a $1,300 deal, and they can afford it. Most of our members don't say anything more. They just say, I don't have insurance, I'm a cash paying patient, I plan to pay for this today, and I assume you'll give me the very best price possible, okay? And then they put their credit card down or whatever, okay? That doesn't mean it's not gonna get shared. It just means that's the simplest way to get the best price and deal with it simply, and that's the way most of our members deal with it, okay? When it does get shared, that money comes to that person and he puts it in an account, and if he's already paid for it, he reimburses himself, okay? Now, if it's something that a member can't afford to take care of, which is very understandable, you're dealing with a $50,000 surgery, not a lot of our families could just write a check for that day, that's totally understandable, then you say a little bit more, okay? They say, do you have insurance? We say, no, I don't, I'm a cash paying patient. But we go on and say, however, I want you to understand that because I'm a member of a healthcare sharing organization called Samaritan Ministries, I'm going to be able to pay this bill in its entirety within about 60 days. I don't care what size it is. 1,500, 15,000, 150,000, 250,000, or if I'm saved to share, $1 million. You're going to be able to pay the total bill off within about 60 days, okay? Maybe 70 at the very most, depending on when you get all the bills and sent to us, all right? And once they understand what you just said, then with very little exception, they're willing to treat you. They're willing to wait for the money because it's well within the parameters of what they're used to waiting for anyway, okay? They're willing to give us fair cash prices almost every time, and they literally view you as one of their favorite customers because you just help them understand that they get the privilege of not having to fight with an insurance company on this transaction, and they have a deep appreciation for that, okay? Most doctors today tell us that it's costing them a minimum of 30% and as much as 65% of their total revenue to pay the overhead cost of dealing with insurance companies. Okay? 30 years ago, there were this many doctors and this many administrative staff, and it is now totally reversed. Now there's this many doctors and this many administrative staff, just primarily dealing with the interface of an insurance company with all the coding and all of the massive paperwork it takes to make insurance companies happen. Does that make sense to you? And so with very little exception, it's almost unheard of for a Samaritan member to not be able to get the health care at the place they want to, all right? I know it sounds scary. You are going to be more involved, okay? Let's talk about that. Let's just move on a little bit. Oh, we missed one right there. Okay. When you're a cash paying patient at a medical provider today, the probability arises that we're going to be able to help you get a discount, all right? A significant percentage of medical providers will write a bill that's somewhat inflated or even hugely inflated, okay? That bill is not what insurance companies pay, and it's not what we hope to pay as well. Some of our members like doing that kind of negotiating, but not all of them. We don't require any of our members to do any negotiating they're not comfortable with, okay? We actually contract with a Christian organization that specializes in negotiating bills with providers. That's all they do. They're very good at it. They've been doing it a long time, okay? They will step in and do any level of negotiating you want them to, including all of it, all right? Right now, they're averaging across the board on all of our needs pretty close to about 45% cash discount on all of our bills, okay? But the bottom line is this. You get to decide where you want to get your health care. And if the best surgeon in the world is up there in Portland, and that's where you want to go, then we're going to help get the best price that we can, but whatever we get, that's what we share, okay? We're not going to say, hey, we think you could have found a cheaper surgeon, okay? We're not going to do that, all right? And we're going to get the best price we can, and then we're going to share whatever that is, all right? Now, if you get a discount, or if we get one, either way, the first thing that we apply the discount to is your $300 responsibility. So if there's a discount of $300 or more in the entire incident, that means that wipes out your personal responsibility. We share the whole thing. That's why I'm able to say, with very little exception, for 22 years, any Samaritan member that's had a significant medical bill, the membership have almost always shared the entire thing, and their out-of-pocket's typically been right about zero, okay? Even on $1 million cancer battle, all right? Because we almost always get at least $300 of discounts on a bill that's $1,000 or greater, okay? And so that wipes that out. So that's pretty exciting news. I hope that you understood what I said about that, all right? Okay, how do you submit a need? As soon as you realize that you got a medical incident that's going to go over 300, which is where we start sharing, then at your earliest convenience, you call our office. You say, I need to submit a need. They transfer you to the member services department. You get a real phone conversation with an actual live human being, with the person we call a member advocate, and you will appreciate that conversation, okay? Pretty much guarantee it. Especially if you've ever tried to talk to an insurance company, you're going to appreciate it, okay? They are a follower of Christ. They are gentle and caring. One of the first things they're going to say to you is, man, could we just stop and pray with you about this? And that's kind of your second clue. It's not an insurance company, okay? They're going to explain it to you. They're going to walk you through it. They're going to answer your questions. They're going to send you out a needs processing packet that includes a form, needs processing form. You're going to get your bills together that are related to that incident. You're going to enter them out for form, and you're going to send them to us, okay? So let's say it was a $30,000 surgery, and we got our normal discounts that we did, all right? So that means that we're going to share the entire thing. Then that $30,000 goes into our software. That gets randomly printed out the very next month into the exact right number of instruction letters. So those members are going to send you cards of encouragement, knowledge that they're praying for you, the checks for their monthly share amounts, and those are written to you, and they're going to add up to $30,000, and you put that in your account, and you make sure your bills get paid, okay? You get the privilege of watching this work, seeing the discounts work, and knowing that your bill got paid because you paid it, okay? No, you don't transfer the responsibility of your bills to any other entity. You get to maintain that. It is a little more work. Most of our members don't mind it, and it's actually kind of exciting, okay? Now, some people say to me, so if I have $30,000 in bills, that's quite a few checks if the biggest one's 405, right? That sounds like a hassle. The only way I know how to answer that question is I say, well, if it sounds like a hassle, it probably will be, okay? But let me point out a couple things to you. One is, there are YouTube videos of Samaritan members with a stack of checks this much, envelopes, inviting their whole church into their home, or their neighborhood, or their family, taking turns, opening those, reading them out loud, praying about them, thanking God, singing songs, turning it into an incredible worship time. And it's an incredible outreach, because the people that aren't a part of Samaritan are just sitting there with their eyes this big open going, this is unbelievable. People that don't even know them are paying their medical bills, praying for them, encouraging them, and it's a wonderful experience, okay? The last thing I can say is that just keep this in mind. Worse things have happened than strangers sending you money, right? It is more involvement, okay? And I don't think our members are pretty excited about typically using it. So that's what it is. So when we publish your need of $30,000, we send you a list, a checklist, okay? It says, here are the checks we expect you to receive, the name and the amount, okay? It's not just random. You get to know who you're looking for. All these checks are supposed to come in 1 month, and they almost always do, okay? When you get your letter that tells you where to send your share amount, we ask you to please do everything you can to have it sent by the 15th of the month. So those are going to come in all 1 month. You're going to check them off when they come in, and then we want that checklist back. That's our accountability system. It works very well. If there's any checks that didn't show up, which is rare, but it does happen, then we will take care of it. You don't have to worry about it. They will show up, okay? It usually takes an email reminder, which has happened to me at least 3 times in 20 years, okay? Jamie, according to our records, it looks like you didn't share last month. And sure enough, I'd somehow spaced it out. I find it, I write it that day. That one's going to get there a couple weeks later, okay? Or maybe somebody quit and they didn't tell us. That does happen. We're going to find that out. If that's the case, we'll reassign that portion to a new family. That one will come the next month, okay? And so that's, the accountability system works very well. The checklist works very well. We're all a bunch of Christians that have committed to do this. We're not asking somebody to suddenly think about doing it. This is a commitment they've already made. They're planning on it every month, and it happens very, very well, okay? Any questions so far?
So from the time that you start your membership and you're approved, you start getting a list of where to send your share fee to rather than into the ministry.
Yes and no.
Okay.
Okay. When I get down to this bullet point right here, Howdy for the ministry, I'll answer what you just said in very good detail, okay?
Okay.
And
And if somebody sends a check to somebody and let's just say it got stolen out of the mailbox, is there any way to find that out, that who sent what and?
well, then let's say you didn't know it,
Right.
all you know is it didn't show up, so that one doesn't get checked off. You send the list back up. We noticed that the Smiths didn't send their check. We call the Smiths, and the Smiths say, hey, we mailed it on the 12th, or whatever, And so then we're going to say to the Smiths, well, could you look at your bank account and see if it got cashed? And then they will do that, and then they'll follow through. And whatever happens, it's eventually going to get worked out. Okay? If it did get cashed, then they're going to have. Then we'll go back to you and say, are you sure you didn't get it? You didn't make a mistake? And you'll be able to say, yeah, whatever. And so then, but we'll follow through, and eventually either the Smiths will send you another check, or we'll reassign that to a new family.
I'm
Okay.
just curious about those kind
Okay.
of stuff.
Okay. Pre-existing conditions is a very significant category that I want to make sure you understand. It may not be a factor for anyone in the room. It may be, I'm not sure. But it is a big deal, and I want to make sure you have the opportunity, especially if you're going to explain it to someone else. You want to understand this, okay? We do have limitations for pre-existing conditions. Let me start with a little bit of background on why that is, all right? I think this is helpful information. Some of you probably already have this figured out. One of the components of the Affordable Care Act, Obamacare, is the mandate that attempts to force all Americans to be involved. If you don't buy insurance, you're asked to pay a penalty. You with me on that? Everybody understand that? It's a mandate trying to get everyone to be involved, okay? I am not a proponent of the Affordable Care Act nor a defendant, but I want to help you understand that that is actually very logical. The mandate is very logical. And here's why. Another component of the Affordable Care Act is an elimination of insurance companies' ability to discriminate against people with pre-existing conditions. Are you aware of that? That's one of the parts of the Affordable Care Act, is that no matter what's going on health-wise, you can buy an insurance policy and not be penalized in a big way, all right? What I want you to understand is that you cannot have one without the other, okay? If you eliminate pre-existing condition discriminations and you don't have a mandate, then there are people in this country that are business-minded that would eventually, maybe within a few seconds, say, hey, there's no limitation, there's no limit on pre-existing conditions, you know, then we're not forced to join, so why buy insurance now? Let's just wait till we're sick and then buy it. That makes sense? So obviously, you can probably imagine if that were to happen, it would go viral, and that would mean the system would collapse within a week or two, because there would not possibly be enough money to make it work. Does that make sense? That's very logical. I'm not a proponent of either one, but it's logical that you can't have one without the other, all right? Now, the same logic applies to Samaritan. We don't, nor are we interested, able to force all Christian families to be a part of us. We don't have a mandate. So therefore, because of that, we must have a limitation on pre-existing conditions. If we didn't, then I'm sure no one in this room would do this, but somebody would say, they don't have any limitation on pre-existing conditions, let's don't join in, let's just wait till we're sick. Why pay other people's bills, okay? And of course, if that were to happen, as you can imagine, that would make the system not work. So we do have limitations. I wish we didn't, but we do. So here's what it means, all right? It means that when you join Samaritan, you don't have to see a doctor, you don't have to get a physical. We're going to ask you 2 questions on the application about the health history of everyone who's going to be in the membership. All right? Question number 1, we ask you to tell us anytime anybody's had a situation with heart condition, cancer, or type 1 diabetes. All right? Type 1 diabetes is a long-term pre-existing condition for Samaritan members. Right? For heart conditions and for cancer, we're looking for a 5-year window of being treatment and symptom free, and then that is no longer viewed as a pre-existing condition. The 5 years doesn't start when you join. The 5 years started when you became treatment and symptom free. So if you had cancer 6 years ago and you've been treatment and symptom free, then we're not going to view that as pre-existing. Does that make sense? If we are viewing it as pre-existing, it's only that specific issue with the heart. It's only that specific form of cancer. It's not just anything, all right? That's question number 1. Question number 2, we ask you to tell us about anything else you've been dealing with in the last 12 months. Any diagnosis, any treatment, any symptoms. So if you've got something that you've been dealing with in the last 12 months, something bigger than a cold or something like that, something that you know could possibly turn into medical bills down the road, then you're going to tell us about that, and we're more than likely going to view that as a pre-existing condition. We're looking for a 12-month window of being treatment and symptom free, and then that would no longer be viewed. That would be waived, all right? Now, we totally understand that there are things people are dealing with that aren't going away in 12 months, all right? So this is obviously a factor, all right? So here's what it means, all right? You're still welcome to join. No one is prohibited from joining Samaritan no matter what's going on health-wise, but there are limitations. So if a family joins and they have a pre-existing condition with one of the members of the family, and down the road they have medical incident that's directly related to that thing that we're still viewing as a pre-existing condition, then what it means is that we're not able to share for that medical incident in our normal sharing process. Okay? I think most of you understand what our normal sharing process is by now. 61,000 households ready to send their share amount where we ask them to every month. We get a letter that tells us where to send it, right? On the bottom of that letter, it says something additional. On the bottom of that letter, it says, Jamie and Eileen, this is your special prayer need for this month. And it describes an incident that a member is dealing with that was not able to be shared in our normal process. Okay? It might say John Smith was hospitalized with complications from his heart, and it was a condition existing before membership. It might say Sally Smith had extensive dental work, and it was a burden to the family. We don't share for normal dental work, but we publish that as a special prayer need, right? We get one of those on the front of our letter every month. Jamie and Eileen are being invited to contribute to that need, additionally, voluntarily, but Samaritan explains to us is that what they've done is they sent that specific special prayer need that month to the exact right number of members, such that if every one of those members were to donate $20, the entire need would be totally shared and met. Okay? Sometimes it's 15, sometimes it's 20, sometimes it's 25. It's never been more than 25. Okay? When you turn your letter over, there's more special prayer needs on the back, the ones that were sent to other families. Not everyone donates to them. Some people donate to none. Some people donate to all of them. Some people pick and choose and say, Lord, what would you have me do? Whatever, okay? There's no guarantee on it, and there's no obligation on it, but it's pretty amazing how generous our members are, okay? So, let me explain that further, because I really want you to make sure you understand what I just said. I don't know how many of you have written a letter of gratitude to your insurance company, okay? I have to confess the thought never crossed my mind that maybe it should have. Our members write dozens of letters to us every month about things they love about Samaritan, okay? So let me quote one of those letters to you. A mom wrote in and she said, I'd like you to know our story. We joined 4 years ago. We had a pre-existing condition with our son. We hoped it wouldn't turn into anything, but it did. He had to have surgery and it was $80,000. You guys published it as a special prayer need and we got $20,000 from them. We called you and we said, Samaritan member said it's $20,000 out of goodness of the party. What a blessing. And you said, well, where's that leave you with your bills? And we said, well, we still owe 50-some thousand. And you said, well, why don't we wait a month and do it again for you? And you published it again for us, and we got another $19,000 from that. Our church took up a little offering. We took that $42,000 to the hospital, and we said, here's the cash we've come up with so far. And the hospital said, you know what? We would be glad to take that as payment in full. And God provided. I can't overemphasize those last three words, okay? And God provided. We are, by definition, a group of people that have chosen to trust in God for our medical needs. And if He wants to use Samaritan, normal share process, He's welcome to do that. If He wants to use the special prayer need, if He wants to use additional discounts, if He wants to use means totally beyond our imagination, He totally has our permission to do that. Okay, but that's who we are. That's who we're putting our trust in. Does that make sense? And so I want you to make sure you understood, and you heard me say in that letter, we said to her, how about if we do it again? Now I know that pre-existing conditions are a factor for deciding whether you think Samaritan's a fit. I totally understand that. But we have watched the body of Christ follow God's leading and take care of people. And the special prayer need has been a huge blessing for thousands of families over 22 years. I just want to make sure you understand that, but I don't want to exaggerate it. I'm not saying that every need's been totally met in that manner. Okay? All right. That's the pre-existing story. Any questions on pre-existing? We all right with that? Okay. Special prayer needs, we just talked about that. Prorating is an interesting thing. I'm going to talk fast, but I think it's valuable for you to understand. Okay, when you begin to think about the possibility of leaving an insurance model and coming to Samaritan, some of us realize what we've been doing is we've been putting our faith in a pile of cash in a building in Omaha. And now what we're actually thinking about doing is putting our faith in God and in the body of Christ and in Samaritan's 22-year history. But there's a step of faith involved in that. There's no doubt about it. Okay. In my opinion, when we do step out in biblically wise steps of faith, God honors that. We grow from that. It's a real blessing. But there's a step of faith involved. And I'm going to explain to you the best manifestation that I know of how that step of faith actually comes about. Okay. Remember I said you've been putting your faith in a pile of cash in a building in Omaha? Well, something I want you to know is there's not a pile of cash in a building in Peoria. I did explain that there's $17.3 million in the Save to Share fund that our members are holding. You can certainly call that a cash reserve, but it's only for that program and those people in that one for the high needs, okay? In our basic plan, we don't store cash. We have chosen for 22 years to believe that the very best way to position ourselves in matter of faith and trust before a sovereign God is to not store cash. Now, there are people that argue with us. There are worldly wise people and insurance experts that say you're crazy. That's how you rate insurance companies. You look at their cash reserves. We understand that. But God has honored our approach for 22 years, and we think this is the right way to do it. In my opinion, it reminds me a little bit of the story in the Bible where King David got in trouble for counting his soldiers. Any of you remember that story? God had basically said to David, David, you're going to have to make a decision on who you're going to put your faith in. If you trust in me, it really doesn't matter how many soldiers you have. If you trust in your soldiers, you may never have enough. David disobeyed that. He ordered Joab to go out and do a census. Joab argued with him, but finally did what he was told. Did a census. God called David on the carpet for that disobedience. He made David choose his own punishment, and 170,000 Israeli men died in 24 hours from the plague for David's disobedience. It reminds me a little bit about that. We've had to make a decision who we're going to trust in, so we don't store cash, all right? What we do is we trust in God's protection and provision that next month's share amounts are going to be adequate for next month's needs. Do we know what next month's share amounts are? Yes, we do. Computers are able to do that. We know how many memberships, what category, we can calculate that. We know that to the penny. Do we know what next month's needs are? No, no idea. Totally beyond our control, right? Okay. As a board member for 14 years, I had the privilege of watching the bar charts that compared the share amounts that were available on a given month and the needs that came in that month. It was amazing to me how consistent it was. I would have guessed it would be all over the place, but it's very consistent, but it's not perfect. So, as I'm explaining to this, some people come up with two questions that I want to answer, okay? Question number one, okay, I see what you're saying. Next month is hopefully adequate. So what do you do if there's not very many needs next month? If there's less needs and share amounts available, what do you do, okay? All right, let's answer that question. First of all, we don't store cash, all right? Those are commitments that our members have made to go to medical bills, and we don't want to waste those. We do everything we can to apply those to medical bills. We have needs in a negotiating process, trying to get a fair price. We'll pull them out as fast as we can so we can publish those. We have needs coming in from the next month ahead. We'll publish ahead as much as we can. We don't want to waste those share amounts. But every once in a while, there's not enough place to send that money. So when that happens, we prorate the share amounts to match the size of the needs, which means that Jamie and Eileen get a letter that month that says, normally you send 360, but this month there just wasn't that many needs, so we only need you to make your check out for 338. Okay? I always like to ask, when did that ever happen with your insurance company? Okay? It's called a share reduction. It doesn't happen very often. It's actually happened 6 times in the last 14 months, but it's pretty rare. Okay, don't plan on that happening. We love it when it happens. Sure, we save $20. A lot of us sent that to a special prayer need. It's not really about the $20. For me, I get excited about it. It just reminds me that God's at work. God is providing, He's protecting, He's answering prayers, healing, and I just get excited about that. It also points out to me that Samaritan's an honest ministry. We could have found a way to squirrel that away and get it into a bank account, but we don't do that, all right? So that's that answer to this question. Now, obviously, the other one is this one, all right? So what happens in a month when there's more needs and share amounts available, okay? And that does happen, all right? So I want to answer that question. I think it's really valuable for prospective members to understand this. When that happens, our leadership has to make a decision. Is this a month we need to prorate the needs? Okay, on that other one, we prorated the share amounts. But we may decide we need to prorate the needs. And it does happen. It's probably 3 times a year on long-term average, okay? They will choose a number. Typically, it's like 95, 90, 85, or maybe 80% that we prorate at. We've never prorated at less than 80. We pray that we never have to, but it does happen, okay? So here's what that means. Let's suppose that Jamie and Eileen had a $1,000 medical need ready to be published next month, but the leadership decided they needed to prorate the needs at 80%. So that means instead of publishing the entire $1,000 of our need, we actually only published 800 of it. Okay? So you're probably with me. You're thinking, I guess Jamie and Eileen might have to pay an extra $200 of that need. Okay? And then you're thinking, well, man, that's probably not even as much as they saved every month of insurance. That's probably not a very big deal. And then somebody realizes, well, wait a minute. What if it was a $100,000 medical bill? Are we suggesting they might have to pay an extra $20,000 of that medical need? And the answer to that question is yes. That is what we're suggesting. That is the technical definition of prorating the needs. However, in 22 years, that has not happened, and that's why I want to make sure you understand this, okay? We have 3 ways that we have kept that from being an actual $20,000 burden to this family. I call them our 3 lines of defense, all right? Line of defense number 1, we apply the prorating percentage, 80, to the total amount of the bill rather than to the discounted amount. So if we had a bill of $100,000 at a hospital, but the hospital had agreed to take $70,000 as payment in cash, which is extremely common, it's usually even less than that. We apply the 80 to the 100, we can only publish $80,000 of that need, but in reality, we only had to publish 70 to take care of it totally. There was no burden left over. With me on that? That's very important because there's almost always very significant discounts on the larger needs, which means that most of the time the prorating ends up applying to smaller needs, okay? That's number one. Number two, in the following month, if there's a reversal and there's less needs than share amounts available and there's share amounts left over that month, then we're authorized by our bylaws to go back and pick up any remaining burden that might be left over from prorating and publish it with those share amounts that are available that month. That happens occasionally and it's a real blessing, okay? That's number two. Number three, since we're a 501c3 charitable organization, we invite our members to make tax-deductible contributions to our member assistance fund, part of which we use as a prorating fund. And so, for 22 years, if we've ever had a significant burden left over from prorating the needs, we have, after lines of defense 1 and 2, we have paid for it out of that fund, and there's still money in that fund today, and our members donate to it every month. Okay?
So is that an actual bank account or is that another
Yeah, it's a bank.
computerized fund?
Yeah, it's a bank account, okay? So there is that fund, all right? So basically what I believe I've just said to you is because through the process of prorating the needs, because of the whole system the way it works, for 22 years so far, by serious downside to the process of prorating the needs, but the upside has been twofold. One is our ministry has been somewhat protected from one of those really weird anomaly months. And second, because of our sharing process, because of the prorating, our members are given a very strong assurance that their needs are going to get published the very next month. Okay? And that's really valuable for us. Remember I said there's 2 other healthcare sharing ministries? Well, there's a couple differences between us and them. Quite often people leave them and come to us, all right? And we always ask them, why are you doing that? Okay? And so we track that. The number one reason that they give us for leaving either one of the other 2 and coming to us is they say this. They say, I thought I was getting into this Christian sharing ministry, but it really felt like I was just dealing with an insurance company. For both of the other ones, they have a deductible they make you choose from. You give them the money, you wait for them to pay the bills, and they have a network they want you to go to, okay? As you've now understood, we're different in every aspect of that, okay? And so that's the number one reason they give us. They say, I really feel like I'm just dealing with an insurance company, and I have a friend who's a member of Samaritan, and I've looked into it, I think I'd like your model a lot better. That's the number one reason. Okay? The number 2 reason they give us, and I hope this is not a very big deal, and I hope it's not very prevalent, but we've had a significant number of people over the last year say, I've been waiting quite a while for them to pay my bill, and it hasn't got paid yet. 4, 6, 8 months sometimes. I hope that's not a very big deal, but you see, they don't have that same process that we have. They just hope to eventually get caught up. But our members know that their needs to get published the very next month, and that's very important to us, okay? So that's prorating, and that's a pretty big deal. The rest of these are going to go pretty quick, especially because we've already talked about one of them. Okay, who can be in the family membership? Our guidelines say that when your child turns 19, they need to get their own membership, unless they're still living at home, which includes being away as a full-time student, and that qualifies up through age 25. All right. We also have a category, just to point it out. We have a separate clause that for those rare families who have a child that may never be able to support themselves, we allow them to be in the family membership in perpetuity. Okay? All right. The tax implications, we pretty much talked about all of those. Let me make one more point. Because you are not transferring the responsibility of your bills to any other entity, you're going to keep those yourself. Some people will say, so if I have a $100,000 medical bill, I can deduct that, right? I mean, there's some pretty good value that can come out of the deducting that. And it's true that you are able to do that. However, we hope you don't do that, because if our members send you $100,000 and you pay that bill with that and you don't have to pay taxes on that $100,000, we think it's unethical to then turn around and deduct the medical bills that you didn't actually have to pay for. Does that make sense? You can do that, but we don't think it's ethical for you to do that, so we encourage you to think hard about that. Okay? Age 65 and older, doesn't take too long. This is another one of the differences between us and the other healthcare sharing ministries. They both will require their members to sign up for Medicaid, which is an income-based assistance program. If they qualify, we will not do that. and they both require their members to sign up for Medicare when they turn 65. We also don't do that either. We operate from a different philosophy that we will never push our members onto a higher level of dependence of the government. Okay, that's just a philosophy we operate with. So, age 65 and older, we don't have an age restriction, and we don't change the price. So here's what that means. Some of our members, when they turn 65, and they go on Medicare, and they continue sharing with Samaritan just because they love it, okay? Some of our members, when they turn 65, they go on Medicare, and they continue sharing with Samaritan because they actually think that they are going to use this as a supplement. We'll share those things, a lot of those things that Medicare doesn't cover. You know, Medicare only covers 80%, so there's that 20% left over. So some people use this in that way, okay? And that's acceptable, all right? A third portion of our members, when they turn 65, they leave Samaritan and they go that route. They go sign up for Medicare, they buy a supplement, whatever they're going to do, and they leave us, okay? That's a reality, that's a fact. And I'm not trying to sell any ideas. There is a fourth category. I'm going to share it with you. I have no idea if it means anything to you, but it is a growing category with us, and it's what I happen to intend to do in less than 2 years when I get to that point, okay? For me, it's a deeply held philosophical perspective. I've been saying to people for 30 years that I don't believe the federal government should be running an entitlement program that removes liberties it can't do efficiently and it does not have the money to pay for. And so because they don't raise the price and have an age restriction, when I turn 65 in a year and a half, I simply intend to opt out of Medicare and stay with Samaritan. That means I don't give up control of my health care to the government, who will decide what kind of health care I get to have and where I have to go to get it. I get to make all those decisions, and I continue sharing within the body of Christ, which I happen to love way more than insurance, okay? I'm not trying to sell anybody on that idea. For me, it's a deeply held philosophy. It allows me to put my money where my mouth has been for 30 years, okay? I'm not going to tell you it's going to save you money either, because if you recall, we don't share for doctor visits that are less than $300. Medicare will help with some of those after you meet the deductible, which is not a very big deal. Medicare is a highly subsidized program. We don't know what it'll look like 3 years from now, but it's highly subsidized, okay? When I'm comparing Samaritan with a family that's purchasing health insurance, then we're almost always way more affordable, all right, nowadays. But it's not necessarily the case with Medicare, and I'm not trying to talk you into it. You do need to understand that if you choose to opt out of Medicare, Part B and or Part D, and down the road, for whatever reason, you decide you want to get back into it, there's most likely going to be a penalty involved, okay? You can go to Medicare.gov and look at that, and explains that it's about 10% on Part B, it's about $4 a year on Part D, is the penalty involved in the premium for not being in. We don't think there should be on Part B, but that involves logic, and they don't normally follow our logic, so most likely will be a penalty, okay? So you just need to understand that, do all your own research, and make that choice however you want to when you get to that point, right? Okay, all right, referral credits. Just very briefly, we are not trying to grow for the same reason that a for-profit organization wants to grow, but we do believe that what we're doing is a great benefit to the body of Christ, and we would love for word to get out. I would give a rough estimate, just a ballpark, probably 80% of the Christians in America have never heard of us, okay? And so we'd like to get the word out. We realized a long time ago that our #1 source of growth, by far, is happy members sharing with their friends how much they love it, okay? So we decided a long time ago to give an incentive for people to do that. So that means that if you join and you love it, which you will, and you start sharing with your friends, and one of them joins, on the application there's a place where we say, how'd you learn about it? And if they put your name down, then the next month you get a $180 credit on your sharing money, okay? For every one of those that happens. I know some homeschool moms in America that fund their entire family's health care through referral credits because they love talking about Samaritan, and there's never been a better time, right? If you want to look at one, write down the name Heather Peters. She's a homeschool mom with a blog with thousands of followers. She talks about Samaritan all the time. She's got more than 400 referral credits, okay? So if this couple, if this guy here is the reason you're at this meeting and you decide to join, put down his name, okay? If he's the reason, or if some other member was the one that told you about it, put down their name, okay? That's not why he did this meeting, but it is just a part of what we do, okay? All right, hope that's not bothersome to people too much. How do we fund the ministry? Okay, you ask a question we're going to answer right now. A lot of people ask this question because you start thinking, well, if we're all sending our money like this, how do you run this organization? Okay, so I've got a good answer for that question, all right? When you join Samaritan, there is a one-time application fee per membership of $200. We also ask you to send your first month's share amount with your application. That comes to the office. That comes kind of like the first third of our administrative budget funding. We do have an administrative budget. It's very significant. We have 220 employees that work at our headquarters in Peoria, Illinois, and then there's me. I get to work out of my home in Oregon, don't have to leave my grandkids. If you want to work for a Christian organization and you like the idea of relocating to Peoria, Illinois, you probably get a job working there. We're growing fairly fast, okay? So that's the first third, all right? Then, for the next 2 months, on a brand new membership, your instruction letter is going to ask you to send your share amount to the office. That gives us the opportunity to see hands-on, you're doing what you said, and it's a valuable second third of our administrative budget funding. All right, you with me on that? You got that, right? So that's a total of 3 months. All right, the first 3 months go to the office. And then from that point on, you with all the rest of our members are in what we call an 11-in-1 model. 11 months out of the year, your instruction letter will ask you to send your share amount to a family with a need, and on the 12th month anniversary of your joining every year, your letter will ask you to send your share amount to the office. That's the final third of our administrative budget fund. Does that make sense?
If you have a need for the first 3 months though, would you still receive a share even if your first 3 shares are
Absolutely.
to the office?
Yep, absolutely. If you join tonight and tomorrow you're in a car wreck, there's no waiting period, there's no delays. This is all going to be shared. Okay. So that's the 3/3 of our administrative budget funding. I think it's a great answer to that question because our members get the privilege of knowing that we actually have a fixed, finite amount of money that we have to live on. Every other organization in the world gets all that money in and they take out whatever they want. And we're not allowed to do that, and I think that's really healthy and wise, okay? Over the next 12 months, our monthly share amounts are going to add up to right at $260 million. Now, I don't know what you guys think, but in my opinion, that's quite a bit of money. And the fact that we don't get that in our bank accounts because of our direct share model, we think there's some really good wisdom in that for a variety of reasons. For one thing, we avoid the temptation of misusing those funds in some small or large way. For another thing, our members take care of sending that money where it needs to go every month, which is an incredible administrative help for us, and they don't mind it, okay? For a third thing, we can't dip into that and take out whatever we want for administrative funding, and we think there's wisdom in that. For a fourth thing, because we don't get that money in our bank accounts, we do not look like an insurance company. And so by God's grace, we have never had to defend ourselves in an expensive litigation battle in any state in America with an insurance regulator who would say, come on, you're basically insurance, you need to come under my regulatory thumb. Unfortunately, both of the other ministries have had to do that. It's been very expensive for them and a hassle. If you look on Medishare's website, you'll see they can't operate in Montana. As an example, that's one of those battles they actually lost, okay? By God's grace, we've never even had to enter in one of those because we just don't look like an insurance company, and we love that, okay? One final advantage that I think is valuable. When you send a check to an insurance company for a premium, that money becomes theirs, and they have every right to do everything they can to keep as much of that as profit as possible, okay? There's nothing evil about that. That's a normal business model. It can be frustrating to some people sometimes, but it's not evil, okay? The fact that we don't get that $260 million in our own bank accounts means that we never have a vested interest to not share something so that we can keep more of that money. And I think that's valuable for our members to understand, okay? Okay, let me talk philosophy for a second, because I've answered an awful lot of numbers questions for you, but let me just talk philosophy. Before we found Samaritan, we were self-employed. I felt like I had to become a professional gambler. I felt like I had to call an insurance company every year and say, we need to make a bet. I'm willing to bet you that sometime in the next 12 months, somebody in my family is going to get deathly sick, and I'm going to need somebody like you to bail me in. And they would say something like, well, we're really glad you're paranoid about that, but we'll take the bet. So I would say, what's the bet going to be this year? And they would say, remember this is 20 years ago, they would say, well, how about $5,000? So my wife and I would sit down with our checkbook once a month and we'd write a check for $400 for a high deductible gambling arrangement that we never won. I know some people have won that bet, and I don't want to make light of that, but we never won that bet. We were never fortunate enough to get deathly sick and win the bet. Consequently, I felt like I was betting against my family. The only way we can ever win this bet is to get sick, okay? that meant, I don't know if you can resonate with this, but I didn't really enjoy writing that check. It didn't feel right to me, okay? We found Samaritan, we joined. To be honest with you, I still thought I wouldn't enjoy writing this check because we're a really healthy family. We may never need this, okay? In 20 for less than $4,000 total in 20 years, by God's grace, okay? It took us longer than it should, but in Galatians, Paul is giving instructions to the church. And he says in chapter 6, verse 2, he says, if any of you has a burden, go to a for-profit corporation or the government who will most likely have a highly efficient, benevolent program that will make you feel appreciated and deeply loved. You guys are laughing because you know your Bible better than that. That's the wrong translation, right? Remember what Paul says? Paul says, bear one another's burdens and so fulfill the law of Christ. We finally realized we get to sit down with our checkbook once a month and we get to fulfill the law of Christ. We get the privilege of bearing the burden of another Christian family we may never meet this side of heaven. And I cannot literally tell you how much joy we get out of writing that check every month, even though we've not hardly ever needed to use it so far. We're following the biblical directive to bear one another's burdens, which is a privilege, and we're trusting in God that when we have one, God will be there, and He can use Samaritan or any other means to do that, okay? I hope you understand what a different paradigm shift that is in the insurance model, you know? You're investing in a for-profit corporation that loves to pay for abortions, that you don't know what they're using with the money. You have to fight with them on all those kinds of things. It's such a different plan than turn around and work within the body of Christ. Follow the biblical directive, bear each other's way. We believe that this was a God-inspired, God-protected, provided program. That's what we believe, okay? You remember I said our members write us lots of letters, okay? Let me quote one more to you, right? This mom nailed it better than I could have. She said, I'd just like you to know our story. We had a really difficult thing last year with our son. It was really scary for a while, but God saw us through it, and he's okay now, and we give God the glory for that. The medical bills were a little over $100,000, and as you know, Samaritan members shared the entire thing. We didn't have to pay one penny. But that wasn't the best part. She goes on to say, there were 3 or 4 times in that process that we were at emotional and spiritual lows, and we were getting cards from Christian families all over the country, and those cards were saying the things that God knew we needed to hear that day. The right words of Scripture, the right encouraging phrases, and the knowledge that hundreds of Samaritan families were praying for our son, lifting up our family before the King of Kings. Believe it or not, that was more valuable to us than the money. That is really the essence of the difference of what our members love more than just the fact that they're saving money, okay? That makes sense? How do you join? There's 2 ways you can join. In that application process, there's an application. You can fill that out and mail it in. On the bottom of the second page, we ask you to tell us when you want your membership to begin. You got 2 choices. You can check the box that says, you started the day you get it, or you can give us a date, July 1st, August, whatever. And as long as it's in our office by that date, we'll honor that start date, and there's no waiting period, there's no delay, okay? There's also an application process on our website that's much faster. You can be a member tonight if you want, okay? So that's the answer to that question. Pretty much have talked about most of the differences between us and the other healthcare sharing ministries, I think. Any questions now?
And that letter that you would need from your validation of your walk with the Lord, does that just get sent in later than if you sign up online?
Yeah, if you sign up online, as soon as you're done and you pay with a credit card or a debit card, then we send you an email that has a code in it, and you can either print it out or take it to that pastor or whatever, and he can actually access online and do that. And you have 10 days to get that accomplished, and it doesn't delay your starting date.
Okay, he's on vacation right now.
Okay. Right.
We'll see.
But it doesn't have to be the pastor of the large church. I mean, it is, you know, sometimes some people, the pastor may not even know you, but there's someone in there that does know you, you know, and you just describe that relationship, and that still works, okay? Any other questions? We covered them a lot, huh?
You answered all my questions.
Good. Well, you remember I started out with some questions, just get your mind starting thinking about the different way we operate. Those are all questions that actually access parts of what our members love. Our members love knowing where the money's going. They love making a connection with Christian families. They love knowing that for 20 years, Samaritan Ministries has a significant bill. out-of-pocket's typically been right at zero, as opposed to that 20, 30, 40,000 of deductible rollovers or whatever. They love saving money. They get to make good choices on what to do with that. And they love knowing that they've got a healthcare approach with an organization whose worldview is much like theirs, and that brings glory to God. You know, and they love it so much that they invite members to a meeting where you learn about it. I have a little bit to talk about here, and I can go either way. Because we're true cash-paying patients, and there's no third-party payer in the room, we get the privilege of helping our doctor understand that he can approach us entirely differently. He doesn't have to worry about coding. See, doctors say that they're no longer allowed to even think of you as a human almost. You're simply a number, which gives them access to a code, which gives them access to a reimbursement from insurance companies. And believe it or not, a lot of times those reimbursements are pretty small, especially when they're paying so much money for the cost of overhead. Okay, so they have decided that they need to get a new one of you in that room every 15 minutes. And when they do come in, they're going to spend 7 or 8 of that minutes typing at a computer terminal, hoping to put as much data in there as possible so that administrative assistant can hope to fill out those insurance forms correctly and not come back rejected, which happens a lot. And every time it comes back rejected, the insurance company gets another 30 days of cash flow on their investment money. Okay, and so we're just beginning to understand that. Let me give you a tiny story. I experienced this and didn't even realize it. I don't see a doctor very often. Last year I decided to get a physical. It's been quite a while. I scheduled it in a little community in Crestwell where I live, because I don't see a doctor very often, and I was 62 years old. I got some things going on with my body, and I started thinking, I got some questions I want to ask him. I made myself a list. Had 5 questions on it out of my pocket. I'm in the room, I'm getting a physical. I pull out this list and say, hey, I got some questions for you. He puts his hands up and he goes, well, hold on a minute now. You need to understand. And when a doctor sees a patient nowadays, we have to put a code down for what that visit's about. When you put down the code for a physical, that's all we're allowed to talk about. If you want to talk about other things, you have to get a different appointment. And I don't know why I said this. I'm not sure. It wasn't a matter of wisdom, but God's blessing or something. I said, well, let me remind you something. There's no insurance company involved here. I'm paying you cash for this time slot. And he went, that's right. We can talk about anything we want to. And he answered all 5 of my questions. So that was a tiny example of what it's actually like to get to be the customer in the room. Okay, and we're just beginning to understand the value of that we actually get to help our doctor understand, because you don't have to worry about coding and all that kind of thing. Does anybody know what ICD-10 stands for? It's the Book of Codes. It stands for International Classification of Diseases. It was produced by the World Health Organization. It's an international record-keeping protocol. It's basically the Book of Codes, okay? It's been revised 10 times. The 9th revision took place in 1979, and it took the number of codes that doctors had to deal with from a few hundred up to 16,000 codes, okay? They went berserk. They had to hire more staff. They had to get all new retraining. It was crazy, okay? When you go to a doctor under ICD-10 with a broken femur, there were 16 different codes that they have to choose from to identify that broken femur properly, so the insurance company doesn't reject it, okay? ICD-10 took effect in October 1st of last year. It took the number of codes from 16,000 up to at least 67,000 codes. And when you go to a doctor under ICD-10 with a broken femur, there is now 1,013 different codes that they have to choose from to identify that properly. And so the insurance company doesn't find a reason to reject it, okay? It's crazy.
So
right?
someone has to go through manually and answer those questions for every patient?
Yep. And it's not the doctor. He has to try to give enough information so the administrative assistant hopefully is getting used to this book and beginning to understand it and knows how to do it. But it's just bizarre. It's crazy, okay? And that's why some of these doctors are saying, I'm done. I'm not doing this anymore. Some of them are retiring early. Some of them are becoming plumbers. And some of them are doing the direct primary care thing where they're saying, I'm not dealing with insurance anymore, okay? If you're ever bored sometime and you want to do something that'll either make you laugh or cry, depending on your personality, Google the words ICD-10 bizarre codes, okay? It's crazy what's in there. I'll give you a couple examples. If you come to the doctor because you got pecked in the eye by a chicken, there's a specific code for that, okay? But they could still get it wrong because they didn't realize that wasn't the first time. If it was the second time, there's a different code for that, okay? Here's one other example. If you suffer severe burns on your legs because your water skis caught on fire, there's a code for that. So anyway, you might find, people have gone through and come up with
These are
bizarre
things that
ones.
have happened and they had to document it.
Anyway, we're finding more and more reason to appreciate the fact that we're cash paying patients. There's a sense in which we're going back in time where when healthcare was like every other part of our economy, our free market system. You found a service you liked, you got a fair price, and you paid for it, okay? It's gotten a lot different than that now. And our members actually, I think, appreciate the fact that we've given up a lot of control, and Samaritan's approach allows us to take some of that control back. Okay?